month's episode of Tea with Lisa. It's June, and so we have a special guest this month, Lisa Ann Wheeler, the Patient Navigator, Breast and Cervical Cancer Screening Program Coordinator, I guess, right? For the Department of Public Health. That's a mouthful.
It's a mouthful.
So I'm going to let her introduce herself and tell you a little bit more about who she is and what she does.
Sure. So my name is Lisa Ann Wheeler. I am the Patient Navigator for the Breast and Cervical Cancer Screening Program with the Georgia Department of Public Health. As Lisa and I were talking about, we all wear lots of different hats. That's one of the main hats that I wear. It's a very rewarding job. I love it. I am able to provide women who otherwise would not be able to access mammograms and pap smears and health care at no cost. So it is a winner-winner. I absolutely adore what I do with the Department of Public Health.
Okay, and so can you share, well, you shared a little bit about yourself. Can you tell us kind of what else you do in addition to the breast and cervical screening?
Sure. So I am on a lot of boards. My husband said if I go on one more board, that's it. So anyway, and I love that because I live in Aiken, I work in Augusta, so I'm on both sides of the river. It is just a little river. People think it's just this giant space, but it really isn't. I'm on Gap Ministries board. I'm with Helms College. They're all sorts of AU and so forth. I'm also an ordained minister. I went to seminary, attended seminary, and graduated in May of 2022. So obviously that's a big portion of what I do. I did an internship at Reds Branch Baptist Church in Aiken, where I live, and Red McWhite's kept me around, so I'm still doing work there, and it's very rewarding. So like us all, we wear lots of different hats, but that's what makes life so rich. I love that. I love that.
So you and I have a lot of common stuff, because I live also not in Aiken but in North Augusta, and then work over here in Georgia. So it's so are your let me ask you about the breast and cervical screening. Are they accessible to those with various disabilities?
Absolutely. And I cover 13 counties. Every county has its own little nuance, of course. Richmond County, I have Uber Health that assists me with transportation. My more rural counties, that's hard. It truly is. As far as women accessing their mammograms, of course, like Piedmont, all of the local providers, think about Jefferson County, Jefferson Hospital. Obviously, people are it's easily accessed.
Okay, so is it like I guess they come to you or you go to them, or how does that work?
Different ways. So I have lots of obviously referrals come to me for patients that are in need of their screenings. And I contact the health department that is appropriate for them where they live, and appointments scheduled. They'll go in for their annual, they'll have their pap smear, their HPV testing, their clinical breast exam, and then we will write the referral for their mammogram.
Oh, okay. All right, sounds good. So if someone has a disability such as maybe a mobility issue or something, I guess as long as the health department is accessible, then it should be good.
Absolutely.
Which I'm going to assume most of the health departments
are
accessible.
Yes, they are. Absolutely.
Because I know
we have
access
a lot of
to
wheelchairs and things like that too. Each county has that access.
Well, I know you mentioned the Uber Health. I think I had heard something about that before. Can you just tell us a little bit more about that?
So I have a tiny budget. It's teeny tiny. But I'm very careful with it, of course. But yes, if a woman does not have access to transportation to get her to the health department or for those screenings, her mammogram and such, then I'm able to use Uber Health to take her to and fro.
All right, that's interesting. I've heard of it, but I didn't know exactly how that would work. So, is there a fee for the screenings?
So if you qualify for the breast and cervical cancer screening program, no. 40 to 64. Under the age of 40, if you're 21 to 39, there is an office visit charge. It's very minimal. We ask that women bring in proof of income, and if they're not working, go to the labor department. They get a form that they bring with us to us. It's basically a sliding fee scale for just that office visit charge. We will, of course, do the PAP, and that will be covered.
So how does someone find out if they qualify?
They would contact me, and we would go over the eligibility. And the eligibility is Georgia resident, uninsured, underinsured, 200% of the federal poverty level or below.
All right, and I guess that's a little different on the South Carolina side.
It is. It's a wee bit different.
And there's the office fee is a sliding scale, you said?
It is for those under the age of 40.
Well, I know you talked about the basics that are offered as far as the breast and cervical screening. So, are there any follow-up or additional services that go along with that?
Yes, there are. Diagnostics.
Okay.
So say a woman comes into the program. She has her screening mammogram, and it is deemed that she needs further imaging.
Okay.
It would be called a CAT 0, basically. That's what they call it. So we would have our patient go back for diagnostics and an ultrasound, and we cover that.
Okay.
Now, if further diagnostics are needed, a biopsy, we also would refer our patients. We work with Dr. Poulier at Piedmont, and we would send a referral there for them to cover that.
Okay.
Also on the PAP and HPV testing, if a colposcopy is needed, we cover that also.
Okay.
So it's not, we do the screenings, but if there is an issue, we are going to take a woman through
those
diagnostics.
It's not just we do the screenings and that's it.
Exactly.
Figure it out. Okay, well that's good then. There's a lot of follow after.
Yes.
After
absolutely.
Yeah.
I mean, we go right straight through. And I will say what is very interesting to me is that there are so many women that we have seen under the age of 40 with lumps and bumps.
Yeah.
And we're seeing women diagnosed under the age of 40 with breast cancer. And sometimes I'm the fifth or the sixth phone call because they just don't know where to go. They're uninsured. We will bring them into the health department, of course, and do a clinical breast exam. And if we deem it necessary, we will go ahead and send them for imaging.
Okay.
But that's a scary space to be in.
Yeah.
You know?
Not knowing
not knowing where to turn, and being uninsured, and all the things. And I'm seeing a lot of women now that are uninsured because just the changes since January. Holy smokes.
Yeah.
Well, insurance, the premiums have skyrocketed.
Yeah.
I actually had a friend who had, it was $700 more a month. Now think about that. She said, I just can't do it. So she's now without insurance, and actually she's under the program.
Yeah.
So able to get those screenings,
Well, and luckily there's programs like yours out there that can help with that.
Absolutely.
So, well, let me ask you, we're talking about events coming up. Will DPH and BCCP, is that letters, be at any of these events? Are you at all of these events?
Girl.
Yeah.
Everything.
Everything? Okay. You're everywhere.
Everything.
You're at everywhere every time, right? Okay.
I try. And I especially my more rural counties, too. I just had an event in Warren and Glasscock with a mobile.
Okay.
Just to have access to a mammogram. It's important.
Do you have a mobile, like a bus, a van, or how's that work?
So a couple of things.
Okay.
So I partner with Piedmont for the mobile mammograms.
Okay.
Also, DPH has their own mobile van. I mean, we go throughout all the counties.
Okay.
And you can anything that you can access at the health department, get on that van.
Oh, really?
Pretty amazing.
Okay. Well, all that packed into a van.
Absolutely.
Well, so I receive your emails all the time. How did you become the go-to person for health events happening in the CSRA?
So one Monday morning, I was at work, and one of my coworkers was like, "How come you were not at blah, blah, blah?" And I'm like, "Because I didn't know about blah, blah, blah." And I thought, well, I need to find out what's going on. Yeah. So now everyone sends me everything, which is great because I push it out. Yeah. And people, I always get lots of thank you emails like, wow, I didn't know all this stuff was going on.
Yeah.
So
there's a lot going on, and we get a lot of emails. So summer's here. Can you tell us all the must-attend community events that are going on in the area?
Absolutely. I brought a list with me.
Okay, awesome.
So, of course, we have, now Reduce Your Risk, that's my nonprofit with Angela and Carolyn. We have our walk the first Saturday of every month at the mall, 9 o'clock.
Okay.
It's wonderful because we were having them outside, and the Southern Belles were like, too hot, too cold. So now we're in the mall. Awesome. Yeah. 9 o'clock, Saturday.
Okay.
Be there, be square.
Okay.
Compass for Hope every Sunday. They have their shower day at James Brown Arena. Wonderful. They do some great work.
Okay.
We have the Wellstar Holistic Grief Support Group.
Okay.
You'll have that flyer. Lucy Craft Laney, their summer camp.
Okay.
We have the Drive-Through Diaper Day for Medical Associates Plus.
Okay.
Very important. Not only diapers, adult incontinence.
Oh, okay.
That's a big call for that here in this area.
Yeah, it is. So. We have a program here where we have incontinence supplies, and so we try and get that out to consumers and stuff. So, but it's a large demand for
there sure
incontinence
is.
supplies for adults. So yeah.
I didn't realize it was such a demand.
Yeah.
But I actually ended up delivering some items to St. John Tower.
Oh,
there were
okay.
a couple of residents that were not able to leave their apartments.
Okay.
So just wrap your head around that.
Yeah.
They could not leave their apartments because of the fact that they were choosing food, prescriptions, adult incontinence.
Yeah. It's a tough spot. So I know a lot of the people you partner with, we also partner with. So it's a lot of good collaboration going on there.
Absolutely.
So, and that is what, once a month with the diaper thing, or is that a one-time?
This is something that they're doing. Medical Associates Plus is doing.
Okay.
Then we have our book bash at the Hub. That's always fun. That's on the 13th of this month.
Okay.
Super fun. A lot of kids will be there, a lot of families.
Okay.
We have an awareness walk, a domestic violence awareness walk in Burke County.
Okay.
And then we have our Juneteenth Family Fun Fest.
Okay.
On the 20th, and of course, my baby, Project Refresh Shower Day.
Yes, I know that's
3 years. This will be 3 years and 2 months that I've been doing that. And I see between 600 and 1,000 people every single month.
Yeah. And there's a lot more. There's a lot to that. I mean, I know they can come and get the showers. And you want to tell us a little bit more about that?
Sure. Well, it started. I mean, God basically just spoke on my heart that I needed to do something for the unhoused. Yeah. That's how it started. Now we have housed, unhoused, seniors. Whole families will come.
Okay.
Especially for June and July, because I have princesses and superheroes. We do face painting.
Yeah.
We have crafts for the kids, all those types of things. So it is just a wonderful event, and it's like a block party.
Yeah.
Everybody comes.
The few times I've been, that's what it reminded me of, a big block party.
Oh, yeah. No, I have a chef that cooks. We had shrimp and grits for the last 2.
Oh, okay.
Oh, was that a hit?
Yeah.
All the bells and whistles, haircuts, manicures, clothing, shoes, anything and everything, right under one roof, and a lot of love. Yeah. I think I hug just about every person that comes.
Yeah, I know you probably did.
I do, and I love it.
I know you're a hugger.
I'm a total hugger. So God gave us 2 arms. That's what they're for. Also, we have the back to school at the Hub coming up on the 25th of July, and then an event at Medical Associates Plus on 8/7. But you have all of those flyers.
Okay.
It's a busy summer. There's a lot going on.
Yeah. Okay. Sounds good. We're offering the screening services at all these different events and stuff. So, okay. So they can do it there, or they can kind of call you.
Exactly. And if it's on a weekend, of course, the mobile is not working. So then I would just take information, make that appointment, and go from there.
Okay.
But yeah, I mean, the Glasscock and Warren, super successful.
Yeah.
Getting those mammograms done, because a lot of women just don't have transportation.
Yeah. I know we deal with a lot of rural counties here too, so I understand transportation is a big barrier for a lot of our consumers in the rural counties. So I can relate to what you're saying. So, what is the best way for community members to learn more about the events and resources, and how can they get involved?
Sure. So contact me. If you would like to be on my email list, it goes out to about 1,000 people right now. And it's everybody.
Yeah.
It's contacts, it's different partners and so forth. Just reach out to me. My email is lisa.wheeler@dph.ga.gov. My best phone number is my cell, 706-513-1033. And if you would like to be on that email chain, let me know.
Okay.
Also, if you have events and you'd like me to promote those events, please reach out. Send me the flyers, send me the information. And as far as joining me, oh, good golly, I'd love to have anybody come.
Okay.
I mean, we need to come out of our brick and mortars, and we need to meet people where they're at.
Yeah.
It's super important.
So volunteers are always welcome at all these events.
Absolutely.
Always.
Just reach out to me. I would love it, especially for my Project Refresh.
Yeah.
Last month, it was myself and one other person till about 8:30.
Oh,
so
wow.
That was challenging.
Okay.
So, yeah, I'm always in need of volunteers.
Okay. Well, how would someone go? Is there a central spot someone could go to look up all these resources or events that are happening? Is there a central spot they can go to?
There is not. There is not. They would need to contact me, and then I would put them in the email chain, and then they'll receive that email.
Okay. All right.
And then also with for my nonprofit, Reduce Your Risk, as far as what events, our walks and our I didn't even mention our cancer support group we have every month.
Well, go ahead and mention that.
Cancer support group. It's the third Monday of every month. It starts at 6:00. It's at the Hub, and it's for everyone, and it's for all diagnoses.
Okay.
So we're talking patients, family members, friends,
caregivers.
coworkers. Anybody's welcome. We provide a dinner, and we have a presenter.
Okay.
And it's super low key. And when I was going with my mom, I felt like I had to stand up and give my social security number.
Yeah.
But this is it's just easy peasy. We come together, we have something to eat, we chat, and it's just a great, it's a great community, a safe space to just kind of be.
It's a lot of peer support going on there.
Yeah, absolutely.
Okay. Well, Lisa Ann, I want to thank you for coming on this month's episode of Tea with Lisa. I appreciate you being my guest. We always have a lot of fun when we're together.
Yes, we do. Yes, we
do. You did get to share a lot of really good information with our viewers, so I appreciate you coming on and doing that. Yeah. If you want to tell them one more time how to reach you.
Sure. lisa.wheeler@dph.ga.gov or 706-513-1033.
Okay. And if you want to reach us here at Walton Options for information or if you need services or anything, just give us a call at 706-724-6262. And our website is waltonoptions.org. You can also follow us on Facebook, Instagram, YouTube, and Shorts on TikTok. So just check us out on all those platforms and see what we have going on. Thank you. Bye.